Some COVID-19 patients can test positive a second time for the virus, but does that necessarily mean that they can infect more people? Fox 2 News investigative reporter Brendan Kirby now joining us live with a new study out of South Korea that suggests some startling results. Brendan?
Well, Byron, from the beginning of this pandemic, there have been stories of people who had seemingly recovered from a COVID-19 infection only to test positive again down the road. If those people are able to pass the virus to new people, it could pose serious complications in efforts to resume normal economic activity. But a study published yesterday by the South Korean Centers for Disease Control and Prevention presents strong evidence that they cannot. The research focused on 285 COVID-19 patients who survived, tested negative for the virus, but then came down with coronavirus symptoms again before testing positive a second time. Yesterday's findings show that none of the people examined were able to transmit the virus. Samples taken from their bodies could not be grown in a laboratory, which shows the virus particles were dead, and those dead particles were not a threat to other people. Previous research indicated that 260 South Koreans had tested positive after having recovered. That raised fears that it was possible to be infected twice, but experts point to the common PCR test used to determine if someone has the disease. That test can't distinguish between the genetic material of active viruses or dead viruses. The new study figures to have a profound impact on how South Korea relaxes physical distancing rules imposed to slow the spread of the virus. Officials in that country say they no longer will consider people infectious after they've recovered from the disease. It remains to be seen what impact this study will have here in the United States. A Mobile County Health Department official said today that she had no comment because she had not yet read the study. Reporting live for Fox 10 News, this is Brendan Kirby.